Shuri from email. I would just like to ask, with regards to backlog cases, when it comes to testing, it was we were made to understand that there are a lot of backlog cases nationwide. So can we know what is the reason that's causing the backlogs? Is it the lack of reagent, machines, or experts? And how are we going to?
No, there will always be a backlog every day because our reporting is on 12, every day at 12 o'clock. So when the reporting, for example, takes more than 24 hours, there will be a backlog at least. So if we continue to test new patient and then the test report is not out yet, there will be a backlog. So after 1 o'clock, then we get the information for the next day. But in the same day, we are also testing more patients. So there will be some form of backlog in that sense. Nonetheless, when we look into our lab, we have actually increased our lab from initially only about 23 labs available in the Ministry of Health as well in the private sector. Today in the Ministry of Health, from 18 labs, we have increased into 20 labs now. And the private sector from 5 to 7. So all in all, we have 27. And one lab in Angkatan Tentera Malaysia, and the other in Malaysian Genomes Institute. And we have 14 labs in the IPTA and IPTS. Total, we have 43 labs. That means it's RT-PCR lab available.
So, Datuk, your expert analysis on this, do you think the MCO should then be extended to make sure that all these backlog cases are settled?
So it's not about I think, but it's about what we can do now to change the figures that we have. So we are monitoring every day. So the responsibility is not only on our shoulders in Ministry of Health, but all of us have to play a part. Now, if we can keep to staying at home and make sure they wash their hands and social distancing, for example, then let us look into the data. The data will tell us whether we need to extend or not. So now I can't predict. I can predict, but the reality is that we have to base on science and facts. So we hope that by 10th of April, the data is available for us to make a decision whether we need to extend or not.